Hello, my name is Amy Mountour, and I'm Haudenosaunee from the Six Nations of the Grand River Territory. I'm also an assistant professor at the Department of Family Medicine, McMaster University. Today I'm going to share with you a case study that illustrates how historical trauma has led to health inequity for the Indigenous people in Canada. I have no significant disclosures. Our objectives today are to introduce the concept of two-eyed seeing as a framework for practicing cultural humility in medicine, to discuss the Indigenous social determinants of health, which are the root cause of health inequity for First Nations, and to apply both of these frameworks to a modern healthcare scenario to illustrate how a two-eyed seeing approach to healthcare can address inequities. We'll start with a story. Leona is an 82-year-old female with well-controlled diabetes and hypertension. She's in great physical condition and enjoys an active lifestyle. One day, she's going out for lunch, and as she's walking up cement steps, she falls backwards and hits her head. This results in multiple skull fractures and many intracranial hemorrhages. Initially, her prognosis is very poor. She's transferred to the stroke unit for further management. Her daughter has indicated that she'd like to be a full code. In the middle of the night, the family physician is called by Leona's daughter. She's quite distraught, saying that the healthcare team is torturing her mother and treating the family like they're a problem. She states that if the doctor doesn't do something immediately, they will take their mother home. The setting of this story is in a hospital room, a typical hospital room. And when the doctor arrives, the nurses are at the nurses' station. They're quite upset, and they say that there are several loud people in Leona's room. It's a 2-bed room. They're very loud and noisy, and they're not allowing the nurses to finish their work that needs to be done in there. And they've been told what the visiting policy is, but they're ignoring it. As the physician enters the room, there are 10 people sitting around Leona's bed. Leona is in 5-point restraints and appears very agitated, and she's speaking her native language. The doctor immediately realizes that the 10 people sitting there are Leona's children, and they're angry with the healthcare team for the following reasons. One is that the healthcare team has said over and over to the family that Leona's code status as full code is unrealistic. 2, the family has been asked several times during the day and the evening how much alcohol Leona consumes, and when she drinks no alcohol at all. And you realize that Leona is delirious, and her children are able to speak her native tongue, and they tell you that Leona is re-experiencing trauma as she did as a young girl in residential school, being held down and sexually abused. And this is the case that we're looking at today. So how did we end up here? Well, for reconciliation, it's going to take Indigenous people and non-Indigenous people in Canada to work together. We have to renew our nation-to-nation relationship. We have to have a critical conversation about Canada. We have to work together to close the gap for the inequities, and we have to improve our relationships between Indigenous and non-Indigenous people. But how do we do that? Well, we have to start right back from the beginning. The UN Declaration on the Rights of Indigenous Peoples declares that all doctrines, policies, practices based on advocating superiority of peoples or individuals on the basis of national origin or racial, religious, ethnic, or cultural differences are racist, scientifically false, legally invalid, morally condemnable, and socially unjust. And unfortunately, here in Canada, we haven't been told the entire history of our country. Many of the policies and legislations that built this country are actually policies and legislations that are built on advocating for the superiority of non-Indigenous people. And so to right the wrongs that we see today, we have to go back in time and identify the wrongs that started this. To do this in healthcare, we need a framework, and a simple framework has been proposed by the Mi'kmaq people. It is called two-eyed seeing, where we learn to see with the strengths of Western knowledge and science, and we learn to see with the strengths of Indigenous knowledge and ways of knowing. And if we can see through both of these eyes, we have a better understanding of the world, of the clinical situation, of the patient standing before us. So where did it start for Indigenous people? It started with policy and legislation. It goes all the way back to the Indian Act, which allowed relocation of Indigenous people, that promoted assimilation of Indigenous people through various means, including residential schools. It embedded racism and social exclusion as part of our policy and our legislation. And any time that you embed racism and social exclusion, you other somebody. And when you other somebody, you impact their self-esteem. And policy and legislation has tried very much to impact self-determination for Indigenous people in this country. And when you impact nation self-determination, you impact all of the determinants of health. In this country, inequity started with policy and legislation, and it even started before 1831, but we know that residential schools opened in 1831. Subsequently, there were several reports, some that were recommending that we continue residential schools, medical reports that said that what was happening was a national crime, and it didn't stop residential schools. In fact, they became compulsory thereafter. A whole separate hospital system was set up for Indigenous people called Indian hospitals, starting in 1920s. Around the 1950s, the federal government started to shift responsibility for schooling to the provinces. But without the mandatory compulsory attendance of residential schools, other forms of abuse took place, including the 60s scoop, which began a huge decades-long maneuver in Canada to place Indigenous children in foster care. We also see the beginning of day schools when Indigenous students were no longer forced to spend the night in these schools. Many of the policies that guided residential schools continued on in day schools. In the 1980s, finally, the Indian hospital system was closed, but that legacy and all of the things that happened in there continue on. In 1996, the last residential school closed. But it wasn't actually until 2011 that Indigenous people in Canada had the right to make a human rights complaint. We didn't have that equality with everyone else. And we can see that the legacy of these policies in 2016 led to 52.2% of all children in foster care in Canada being Indigenous. That's a gross overrepresentation when only 4% of the population is Indigenous. What is self-determination for Indigenous people? When I read the statement, sometimes people feel that it might be aggressive or trying to start a fight with somebody, but that isn't the meaning of this. The Chiefs of Ontario have an organization together that they can speak with one voice. The map that you see here indicates all of the Indian reserves under the Federal Act, but more than 50% of our people live in rural communities. So there are Indigenous people all over Ontario. And who we say we are, who we have always said we are the Anishinaabe, the Mushkegowuk, the Ongwahaway, and the Lenape peoples, sovereign nations of Turtle Island. We have jurisdiction to administer our own political, legal, economic, social, and cultural systems. And as sovereign nations, we have never surrendered our rights or title. Not to Canada, not to the British Crown, not to anybody. This is who we are before Canada. This is who we are in 2021. That leads us to the intermediate determinants of health, which are the systemic effects of the disease. And we can see this everywhere in our healthcare systems, our education systems, and our community infrastructure, resources, and capacity, and how the environment is viewed and who is the steward of that environment. And again, self-determination in terms of our cultural continuity. I put this picture up here because a lot of folks have never seen a status card. And for First Nations people in Canada, the federal government decides who we are and what rights we have. And if we are deemed as having status First Nations, we're given this card. And it does give us some benefits, but it comes with a heavy legacy. Our people for a long time have been dehumanized in research. If we look at the Quabell vaccine trials in 1933 to 1934, when the BCG vaccine was being experimented on Indigenous children, they knew that the children were malnourished. They knew that they were suffering from diseases related to poverty, and yet they continued the vaccine trials and never intervened to help in the poor state of the children's health. There were further nutritional experiments from 1942 to 1952 that happened in remote Indigenous communities as well as residential schools. These children were malnourished, and everyone involved in the trials knew it. But nobody stepped in, nobody intervened. The Indigenous children were seen as experimental material, much like rats or mice. No intervention came, and people died from malnourishment and starvation. When you have systems that are based on policy and legislation that make somebody less than or inferior, then the system cannot meet the needs of the people. And if the system cannot meet the needs of the people, then the individuals suffer. And that brings us to the proximal determinants of health, the symptoms of the disease. And this is what we hear about in the news all the time: the physical environment, insufficient housing, overcrowded housing, homelessness, poor sanitation and waste. We know from recent news articles that drinking water, safe drinking water in many communities is a luxury that none have ever known. Employment and income, education, and food insecurity. But if we only look at the proximal determinants of health, we ignore how the system and the policy and legislations that built the systems contribute to the disease that is happening to the individual in front of you. Most of our health research, most of our data is based on a deficit model of poor, sick Indians. But I submit to you today that yes, Indigenous people suffer inequity and they suffer poor health outcomes because of that. But they are a resilient people. They live in a state of chronic stress. They deal with racism on a daily basis, and yet they're still here, despite all of the policy and legislation, despite the systemic racism, they're still here. But if we don't address systemic racism in the healthcare system, and indeed in all of our systems, then we are going to have deadly consequences. And we can see this in the death of Joyce Echaquan. Her story leads back to the Indian Act, where the lives of Indigenous women were changed, our roles were mischaracterized, and because we were a strong matriarchal people, that was taken away from us because that wasn't the model of feminism in British and French societies when they colonized this country. And because we didn't fall into that model, we were seen as being deviant, as being sexually free in a time when that was not allowed to be. The Indian Act took this ideology and enshrined it in policy and legislation, which led to gender discrimination. It targeted kinship and family systems and blew those apart. And it introduced even further bias based on geographic impacts. And the outcome of all of that is missing and murdered Indigenous women and women like Joyce Echaquan, who had died when the healthcare system failed them and in fact abused them in the very last moments of their life. So policy and legislation that is built on false ideology, that leads to systems that are built on false ideology, leads to serious impacts, including death for Indigenous people. And the trauma that Indigenous people feel, it is not just one thing in one generation. All Indigenous people have a principle of 7 generations, that everything that we do today is built on what came before us, the work of our ancestors, and every decision we make today should benefit our grandchildren and our great-grandchildren and our great-great-grandchildren all the way out to the 7th generation. But similar to how good can impact generations forward, harm can impact generations forward. And that's what trauma has done for Indigenous people. It's more than just an individual being traumatized. A nation was traumatized. Nations that were traumatized had communities that were traumatized. And when communities are traumatized, families are traumatized. And when families are traumatized, there is no other outcome but for individuals to be traumatized as well. But we can change the narrative together. We can stop talking about poor, sick Indians, and we can talk about the resilient, strong Indigenous people that have been here for thousands of years and are still here and are still hopeful of moving forward and creating a world where 7 generations from now, all of our children are happy and healthy. And to do that, we have to stop focusing on all of the deficits, all the things that are broken, all of the things that we think are wrong. And we have to start building on cultural identity, the social connections that drive everyday life, on resilience, on family and community wisdom, on relationships, and having a vision for the future and restoring the self-determination for Indigenous people. And to do that, we need to find points of connection. So if we look at Maslow's hierarchy of needs, it's a very simple way of understanding how individuals, and in this case, communities, can achieve self-actualization. But for Indigenous people and communities, we're fighting more than just the bottom tiers of Maslow's hierarchy of health. We have the distal determinants of health, which have impacted cultural and familial connections and self-determination. We have the intermediate determinants of health, which are a legacy of abuse from residential schools, overt and covert racism, as well as a lack of cultural safety in the system, which has embedded societal stereotypes and biases. And then we have proximal determinants of health, which is our environment and basic needs. And we know from the news today that Indigenous communities lack basic necessities of life, and they haven't been given the opportunities to achieve the same level of socioeconomic and educational status as our non-Indigenous neighbors. And our land to which we are so connected, has been disconnected from us. So when we think about resiliency factors and the things that people need to do to be well, we have to think about more than just the individual. We have to think about the community and the nation. And how do we heal all of those levels, nation, community, and individual, to really, really move the needle on equity and health for Indigenous people? So to conclude our case, how do we look at it with 2 eyes? Well, if we look at it through the determinants of health framework, we can say what factors are influencing Leona and her family. In the distal determinants of health, there's definitely trauma being relived from residential school experience. In the intermediate determinants of health, there are hospital policies that are not inclusive of large Indigenous families, restraints policies that are not in keeping with this Indigenous family's worldview, and an overall mistrust of the Western system that has for so long, over many decades, treated generations of Indigenous people like they were inferior. And the proximal determinants of health, the perception of the staff that Leona's Indigenous background had to include alcohol use was false. So how does an Indigenous physician approach this? Well, first of all, let's change the setting for Leona. Let's remove those restraints. Speak to her in her native tongue. Make sure your words are soothing and reassuring, and monitor for pain and treat accordingly. And then we need to provide education to the nursing team. They need to know the importance of having all 10 of those children there. We so often in Western medicine forget the spiritual part of people and how we need to tend to that as well. We can't just treat pain if we're not treating the psychosocial pain that they're having as well. And to do that, we need to let the nurses know how to do that. They need to know about the legacy of abuse that occurred in residential school and the role of the historical factors that contribute to mistrust of the system in general. And then support and educate the family that the hospital workers are only bound by the policies that they have always known, and encourage the family to stay involved despite the difficulties. And compromise. Find a way for one or two family members to be the point of contact, but make sure everyone has input. And then advocate for change. This physician went to the Law Commission and advocated for change in the substitute decision-making process, as well as to the hospital and advocating for a visiting and restraint policy changing, as well as cultural competency training. We all have a responsibility to change the system, and to do that, we have to gain knowledge. We have to examine and change our attitudes, and then we have to build skills. And once we can do that, we can affect an individual's health, then affect the community's health, and then affect the nation's health. We must return to the relationship of the two-row wampum. This wampum represents how Indigenous people and non-Indigenous people should relate to each other. The waters of our relationship are peace, respect, and friendship. And I will never go into the European ship and try and drive the European ship. And newcomers to Canada should never get in my canoe and try and drive my canoe. But we can help each other, and we can go down in the river of life together as brothers. So please remember that the relationship is the basis of all things Indigenous, right from our individual relationships right to our nation-nation relationship. And it takes more than just one visit, one handshake. We must work together to get over time, always remembering to go back and polish our relationship together. Thank you.